Hey everyone, and welcome to this series of conversations with people who chose to speak out and ask difficult questions during the COVID era. At first glance, you might think this is a podcast about COVID. In reality, it's about something much bigger. It's about freedom of speech, intellectual honesty, and the right to question official narratives. It asks these fundamental questions. Do people have the right to challenge consensus? Is it ever justified to silence dissent in the name of public health, especially when those raising concerns are qualified to do so? And what kind of society do we become when fear replaces open dialogue? These conversations aren't telling you what to think. They're an invitation to listen with an open mind and an open heart. You may not agree with every viewpoint shared here, but we hope you'll agree on one thing. A healthy society depends on the freedom to ask questions, explore alternatives, and speak without fear of persecution. The information shared in this podcast represents the personal opinions and experiences of the guests and is provided for informational purposes only. It is not intended as medical advice and should not be relied upon as such. The host does not endorse or promote specific medical claims or treatments. Always seek the advice of qualified healthcare professionals with any questions regarding medical conditions or health decisions. The UK government and NHS state that COVID-19 vaccines authorised for use in the UK meet regulatory standards for safety, quality and effectiveness and are offered to those at higher risk. Any views expressed that differ from official guidance are personal opinions and should not be taken as medical advice. Listeners or viewers should consult NHS sources or healthcare professionals for individual health decisions. Hey everyone, and welcome to COVID Skeptics, a podcast that celebrates those true skeptics who stood up and spoke out against the COVID narrative, often at great personal and professional cost. This is an opportunity to hear their stories, what it was like to speak out at that time, whether they feel vindicated, and what lessons we can learn moving forward. My name is Shirley Blanche, and today I'm really delighted to be joined by the truly inspirational Dr. Kelly Victory, who is a board-certified emergency medicine physician, trauma and emergency specialist with decades of clinical experience. Kelly, thank you so much for joining us today.
Thank you so much for having me.
So the thing that I think is so fascinating about you is that your bread and butter really is in trauma response and it is in emergency response, which I think a lot of the things that were put into place during the COVID pandemic, we were told, was due to that and was down to public health. So if you can take us back to when COVID hit, what were you doing then? What did your life look like then? And when did you start to think that maybe things weren't going according to how you imagined they would do in that situation?
Well, again, thank you for having me, and thank you for taking on this very important project, Shirley. I think it's critically important for us to highlight those people, frankly, who got it right the first time, because this will happen again. We will end up in this same position. And when people are struggling for who they should listen to, who they should turn to, I would suggest it should be those people who called it right the last time. My specialty, as you said, is in emergency medicine and trauma. I became a mass casualty and disaster specialist many, many years ago, and I have a deep background in public health. I trained at the School of Public Health and the Kennedy School of Government in a very important program regarding training leaders for times of crisis. So when COVID came along and I was aware of the virus that people were concerned about very, very early, it was January of 2020. And it was on my radar because I keep track of these things and I get feeds on it. But I was alarmed within a matter of days that I was hearing people saying things like, oh, this is going to be different. This is going to be a pandemic. They were predicting something way ahead, which made my hackles go up initially. I suppose I am somewhat of a conspiracy theorist, that's the term they like to say. Which means fundamentally that I am always suspicious of what I'm reading first. And there's an adage in disaster medicine that first reports are always wrong. Okay, so when you hear something, I always wonder what's really going on. And then within a matter of weeks, it became very clear to me that there was something brewing out there that was atypical. And when I started hearing people talking about the concepts of wearing masks, for example, for something that was known to be a respiratory virus, right away, red flag, because we've known for decades that masks do virtually nothing to stop the spread of respiratory viruses. So that was flag number one. Flag number two, it was very clear. I am not a geneticist, but we had access, Shirley, to the genetic code for this virus very, very early on, way earlier than they would tell you. It was in January of 2020. Wow. And it was clear even to me, someone who's not trained as a geneticist, but who understands once they present the code, how to look at that this was a man-made entity. This pathogen did not occur in nature. It had been manipulated. And the example I'll give to people who are non-scientists, or even those who don't understand what I'm talking about, if you've ever received a Word document from someone where they have cut and pasted sentences or a word or a phrase from, and they forgot to get the fonts just right. In other words, the document's in Times New Roman, but this one phrase is in, Calibri or some other font, or the size is different, or the color's different. Everything else is in black and this is in gray. That's how this genetic code looks. You can tell that something was cut and pasted in to the native code. You can see the staple marks at the end, if you will. You can see the Scotch tape where they plugged in this piece. So that was a huge flag. This was something that came out of a laboratory. Wasn't clear exactly where at the moment, but that was number two. And then obviously, as we moved forward and started talking about things like lockdowns, school closures, limiting the ability of people to travel, when again, one of the things we knew very early on was that children were at fundamentally zero, healthy children, zero risk. So why would we do something draconian like lock down or close schools or prohibit children from playing in sports? All of these things were big time red flags. And I think it fundamentally went back to my training in public health, which is that we never isolate the many to protect the few. We isolate the few to protect the many. That's biblical. If you go back to the leper colonies, you take those people who are known to be ill with something contagious and you separate them from the pack. You don't separate the pack and force healthy people to stay indoors to protect others. That's an absolute, abomination, and it doesn't exist anywhere in public health, or shouldn't exist in public health when applied appropriately. And then I suppose the last big piece before we get on to the vaccine debacle was the concept of social distancing. What an absolutely farcical idea. And I laughed about it early on until I realized how significant an impact it was going to have. The idea of standing 6 feet apart having some impact on the spread of a respiratory virus is preposterous. Mm-hmm. But when I say the impact, this wasn't just a nuisance. It wasn't just an inconvenience. It destroyed the lives and livelihoods of millions of people. Mm-hmm. All those mom and pop shops that couldn't afford to cut down the capacity to 50%, couldn't afford plexiglass shields, couldn't afford to spread their tables out or build an outdoor patio. Social distancing was the rationale for not allowing people to go in and visit their loved ones as they were dying in the hospital. Mm-hmm. It was the rationale for saying you couldn't go to your child's graduation or to a wedding or to a funeral. So this absolutely corrupted concept of social distancing was the rationale for what ended up truly destroying people's lives.
And I think even at a very basic level, and I'm not medically qualified at all, but I know that two of the greatest impacts on health is one, fear, and two, isolation.
And when
Correct.
you've got fear and isolation together, I didn't understand how that was going to help people. It just seemed to me that there was nothing being done to help people improve their outcomes should they come into contact with the virus. You know, we weren't having healthy alternatives suggested. No one was suggesting we get our vitamin D levels up. No one
Correct.
was suggesting we supplement. No one was suggesting we
Correct.
cut down on alcohol intake, eat healthily, or do any of the lifestyle changes that it just seems really common sense to have at a time.
In fact, it was the opposite, Shirley.
Yep.
It was stay indoors, hide in your basement, and eat Pringles and order, pizza. And you are quite right with regard to the social isolation. When you think of what is the punishment that we impose on the worst of the worst criminals in our country is solitary confinement. That is what we do to the worst of the worst. What do you think that does to someone who's elderly, ill, struggling, to confine them, to not allow them to be in contact with their loved ones, and then add on a heaping spoonful of fear on top of that? It is probably the quickest way to degrade someone's likelihood of actually recovering from anything, COVID or otherwise.
So back then, I mean, you were kind of mainstream in the medical profession, doing all your emergency response stuff, and you're looking at this and you're seeing this and you're thinking, because you're an intelligent human being and you're using your intelligence to be skeptical and to analyze the data and the actual information rather than just believing what you've been told. So what did your life look like then, and how did it impact? How was your thinking sort of impacting the way that this was going to go? Because I can imagine you could have just jumped on board with all of the COVID stuff and just gone along with it, and that could have been very lucrative for you.
No, I was very outspoken from day one. And in fact, I was one of the first people to be kicked off of Twitter, YouTube, Instagram, and Facebook. It happened the third week of January when I posted that the virus was man-made. I said, this is something that's been lab manipulated. And I immediately was kicked off. That was my first suspension from Twitter. Wow. And I thought, if I use the military adage, it's you always take the most shrapnel when you are directly over the target. Yeah. So I knew that I was on to something, and I thought, well, I'll double down. I don't care. And then very quickly, I got hauled in front of the medical board the first of 7 times that I was hauled in front of the medical board in various states. Interestingly, never having anything to do with something that I had done with a patient, all regarding things that I had said on television or radio or had posted on my social media feed. So again, I did successfully, unlike others, tragically, I was successful in defending my medical license 7 different times during the COVID debacle. It was debilitating, it's exhausting, demoralizing, and very expensive. But I did it. And again, all having to do with things that I said, which in and of itself was a red flag, because we are now talking about, I don't forfeit my freedom of speech, at least in this country, in the United States, simply because I have MD after my name. Yet here they were telling me, you can't say that, you can't. So it was very, very interesting to watch that play out. And I made a decision early on, Shirley, I don't know why, perhaps because I have a very deep faith. I am very mission driven. And I'm fortunate, at least at this point in my career, to say, you know what? I live by the words of John Milton. Virtue untested is no virtue at all. If anyone can do the right thing when it doesn't cost anything, when there's no consequence, it doesn't hurt. The question is, can you do the right thing when there's huge consequence and when there's potentially huge loss? And I made a decision that that's what I was going to do. And I said early on, I may be dead and gone, but I promise you, I will end up on the right side of history. I will be right. I am right. I know I am right scientifically. I know I am right on this morally. And this was kind of the emperor has no clothes sort of thing. Yeah. Who's going to be the one who's willing to say, You've got to be kidding.
Yeah.
And I think one of the toughest things was arguing with my own colleagues, people who are smart people, who I believed to be moral, good people. And I would catch them aside in the hallway or at a party, at a gathering, and say, look, I sat next to you in virology class. You know, for the love of God, 6 feet distancing? Are you kidding? You know that this is fantasy. And they would shake their heads and say either they were so fearful themselves of the virus, or they say, look, Kelly, I know you're right, but I have a family or I've got a mortgage. And I'd say, I do too. I have a mortgage too. I don't want to lose my career either. But if we all stood up together and all spoke out, this would go away very quickly. Tragically, as you know, that's not what happened. And I would go on to say, this is not the first time in history when physicians were co-opted to perpetrate atrocities upon humanity. And I don't just mean during the Third Reich in Germany. It's happened certainly at other times in the United States, during the Tuskegee experiments, when we, were injecting Black people with syphilis to see what happened. We've done experiments on our military that are unconscionable. And if were it not for the complicity, I hate to say, of my fellow scientists and physicians, the COVID debacle would never have gotten the traction that it did.
Did it surprise you? Did that surprise you? Did the level of censorship, the action that was taken against you, and the complicity of your colleagues, were you surprised by that, or did you think that was going to happen?
No, I was absolutely shocked. I was stunned at how quickly, number one, not only the average American, but my own physician colleagues were willing to give up their own civil liberties for the promise of some, security or safety that was going to be given to them by the government. How quickly people were willing to allow the government to impose these things. The masks, I believe, were very symbolic. There's nothing more dehumanizing than forcing someone to cover their face. It is the absolute act of, submission to do so. And I refused to do it other than when I was absolutely forced to, for example, to get on an airplane. Yeah. And even then I was the constant dissident, pulling it down under my nose and hanging it from my ear. I pushed it as far as I could, short of getting arrested in most airports. But I think that it was that sort of thing. And I was shocked that my colleagues gave into it. I can't say I felt badly for the many non-scientists, the non-physicians, non-clinicians who are going based on what they were hearing from the mainstream media, because the mainstream clearly was painting this horrific picture. But my own family, I had many brothers and sisters, 5 brothers and sisters, they all bought into it. And they kept saying, they really thought I was crazy at the time. They now largely have come around. Most of them have come around and said, 5.5, 6 years later, wow, you were right. I was so scared. I don't know why I didn't listen to you. And I understand fear is such a powerful force. It is so easy to manipulate someone with fear. And that is why I think, again, back to the importance of this project you are doing, if we don't expose and explain to people how they were manipulated through fear, through a psyop, through the psychological component of this, then they are seriously at risk for falling for it again, because this was so politically expedient. The powers that be, whoever you believe that they are, the elites, public health, whoever it is, different governments around the world, the pharmaceutical companies, whoever it was, they learned very quickly that fear is a great way to control people. And they will employ that again because it was so useful.
It is very interesting. And I think if you look at what happens in our brains when we're in a fear state, it makes us very suggestible because our brains aren't thinking properly. We're in a fight or flight response. And so I think you're right. I think it was a very, very powerful weapon to actually use. Coming from a public health background, because I think for people like me who aren't scientists, we were told trust the science, which I found odd because I'd always thought that science was having people debating and you could actually then look at the information that was being presented and then make an informed decision. And it seemed to me that there was a sort of disconnect between public health and science. And we were being told, well, we can't always be as scientific as we'd like to be because actually public health messaging needs to be very clear and we need to make people behave in a certain way so that we can keep everyone safe, and all that kind of stuff. I mean, I've never seen public health weaponized in the way it was then and so political. But you've got a background in public health. So do you have any opinions around that?
Oh, much. And they totally bastardized the entire construct of public health. Public health is obligated, Shirley, to consider the outcome, the impact of any particular mitigation scheme on the entire population, not on an individual. It's quite different from regular clinical medicine. If you come into my emergency department, you are my sole concern. It is you and me, doctor, patient. I don't have to consider anybody else. When I put on my public health hat, that is very different. I now need to consider the impact on what I do on the health of the entire group. And not just, by the way, physical health, also economic health, spiritual health, emotional health, psychological health. So the concept of employing a lockdown, this idea that we have to protect everybody or that if we can just save one life. No, I'm sorry. That is not the mandate of public health, is not to consider one individual. You have to consider the health of the entire group. And they knew that, but they defied it. And in fact, you have, for example, Deborah Birx, who in our country known as the Scarf Lady, who is out every day on media talking about how we needed to lock down and wear our masks and socially distance and get vaccinated 17 times. She acknowledged in her book that she and those others around her, Anthony Fauci and the rest of them, lied to President Trump because they knew that if they told him their real plan, that it was never going to be 2 weeks to slow the curve. It was never going. They lied because they knew, being the businessman that he is, that he would understand the profound impact that that was going to have on the population, and he would never have gone for it. So they lied. They were dishonest. Furthermore, even the most basic constructs of public health were defied. There is no such thing. I'm here to tell you, there's no such thing as quarantining healthy people. As I said, you quarantine sick people. Quarantining healthy people is otherwise known as tyranny. We don't do that. We don't take and lock up healthy people, force healthy people to stay in. That simply is a defiance of public health. And again, I tell people you can look at any book on public health that I have in my library, and I have many, and you will not find in the index the term social distancing. It doesn't exist. It was a made-up idea, and now, finally, years after the fact, we have Anthony Fauci himself acknowledging, finally admitting they made it up. They made up the 6 feet. They tried to come up with what would people actually believe. They thought 3 feet isn't believable and 10 feet's not sustainable, so we'll make it up. That's, I would say, it's not only dishonest, it's evil. It's actually downright evil. When you are a public health, quote, expert, holding the kind of authority that you have, the sway over people's lives that you have, and you out and out lie, what they call the noble lie, that you're doing it supposedly for the good of others, is not acceptable.
Absolutely. And I know that, looking at your background, you've not necessarily come from a conspiracy theory background where,
no.
And so moving on to the vaccines and all that kind of stuff. So I'm assuming that in the past you've been a big advocate for vaccines, that you wouldn't necessarily have turned around and been labelled an anti-vaxxer, and you've come from this public health. So assuming that, in the past, with your public health background, you would have advocated for vaccination in a population.
Absolutely right. In fact, in years past, and I mean going back, say, 10, 15 years ago, there were many people who would have considered me a vaccine zealot. I spoke about how important vaccination programs were. I was on the record, and I acknowledge it, saying things like, people don't remember the scourge of polio, and that in the United States we have a president who had been in a wheelchair from polio, and it was the polio vaccine that eradicated the scourge of polio. Except that it turns out that none of that was true. But I didn't know that at the time. I was very pro-vaccine. I'm probably more vaccinated than many people because of what I've done for a living and places I've gone to travel. So I've had some of these strange vaccines. But it became very clear, I really knew from the day one that the mRNA technology was going to be a disaster. mRNA technology, they kept trying to make it sound as if it was tried, true, and tested, safe and effective, all of this, when the reality is scientists have been working with mRNA for decades and it's always failed, sometimes with horrific outcomes. So when they said our mRNA, I said, whoa, why are we doing that? Furthermore, we have never been successful at creating an effective vaccine against a coronavirus. About 28% of all upper respiratory infections are caused by coronaviruses. If we could have come up with a vaccine for the common cold, don't you think we would have? We've always known we can't because they mutate too quickly. Same thing with rhinoviruses. Otherwise, we would have had a vaccine for the common cold a long time ago. So multiple things started making me question very early on. mRNA, absolutely no way. Don't take it. Stop. This is a bad idea. And the idea of even thinking that you could create a vaccine against a coronavirus. Two things. What happened to me over the next months and then ultimately years, the last 3 or 4 years, I went back and did a deep dive on all vaccines. And that's when I realized this isn't just about the COVID vaccine being a disaster. This is about the entire vaccine program being corrupted, that there have been absolutely zero double-blinded randomized controlled trials on any of the previous vaccines. And I looked to see when I was growing up in the United States, the number of vaccines that were recommended by the CDC between birth and age 18 were somewhere between 6 and 8, depending on which state you lived in. All of a sudden, in 2020, when this all started, that number recommended between birth and age 18 was all of a sudden 80 vaccines. Add in the COVID vaccines and it went up to 84. How did that happen? And it turns out that happened because in 1986, our Congress passed a law called the Childhood Vaccine Injury Act that said if any vaccine gets put on the recommended list by the CDC, that vaccine, the manufacturer, is protected against all liability. In other words, they can't be sued. This was an attempt by our Congress to incentivize pharmaceutical companies, vaccine manufacturers, to be more creative and to come up with more vaccines for different illnesses that they were saying they couldn't do because there was too much liability imposed upon it. Well, I don't know about you, but I wouldn't buy a car or a blender or a car seat that had it on the outside. If this malfunctions and your child is maimed or killed, there's no recourse. You can't sue anybody. Nobody has any liability. Furthermore, can you imagine how quickly they could design a new car, a new blender, or a new car seat if they didn't have any liability that they were concerned about? They could crank it out really fast with essentially no studies, no safety data, and very little efficacy data. And so that is what has happened. So I really would now say, if you want to call me an anti-vaxxer, yep, I in fact am. What I am is pro-science, pro-data, pro-safety, and pro-patient choice. And we have defied that with our current vaccine program. Fortunately, just this past week, HHS and Robert Kennedy Jr. At the helm has dialed that back. So the recommended number now in the United States for children has gone from 85 down to 30 vaccines. They eliminated 55 of the recommended ones, which includes the recommendations that healthy children should be vaccinated for COVID and RSV and influenza, those sorts of things. I still think there's room to get rid of others on the recommended schedule. Doesn't mean that they're not available. You can still get them and insurance will still pay for them. It simply means that because the CDC isn't recommending that they are necessary, that schools will not apply a mandate or say, in order to attend our school or our sporting program, that children need to have these things.
I mean, I was sort of stunned because I've got two children grown up now, but I had them vaccinated. We had nothing like that amount in the UK.
Yeah.
I mean, I can't tell you, maybe it's 12. I don't know.
Right.
It's just like a really small amount in comparison to you have in the US. So that, I think that tells you something. That tells you that it's a sort of business model. And one of the other things that I thought was kind of weird with the whole COVID thing is, one, you've got this brand new technology that's being rolled out, which meant that they changed the definition of vaccine. So it was no longer the traditional vaccines that people knew about and assumed that they were. And I think a lot of people still probably assume that they were the same as all vaccines. And so that was interesting. But also there was the whole thing around early treatments as well, in that there was a weird thing with early treatments where they didn't seem to be wanting to look to treat people. It was just like, well, there's nothing else that we can do for you. If you get COVID, there's nothing else that we can do for you. You just got to wait for a vaccine. You've got to sit at home, hope you don't get too ill, stay away from everyone, open up some wine at 10 in the morning because off licenses are essential businesses, all that kind of stuff. And just pray to God you don't get ill because there's nothing else you can do. That I found a bit weird as well.
Absolutely. It's what I call clinical nihilism, as if there was nothing you could do. And we knew early on there were many things that you can do, even before ivermectin and the clear-cut efficacy of ivermectin. We knew that steroids, hydroxychloroquine, lots of things would be helpful. Vitamin D, one of the simplest things that people could have done was to get their vitamin D levels up. We knew that people who had vitamin D levels above 60 had almost a zero chance of even getting ill with COVID, let alone being hospitalized or dying. So, yet something so simple, so effective, so inexpensive was absolutely verboten. You could not even mention it, let alone talking about, for a long time we had to say the I word or the H word because you would be deplatformed if you even said ivermectin. We knew that ivermectin, yes, it is an antiparasitic. Yes, it's used in the veterinary community, but it's been used in in humans for decades. It's been FDA approved for use in humans since the 1980s. It won a Nobel Prize because it's so powerful. And we've known that it's not just an antiparasitic, but it's also a very powerful anti-inflammatory and a very good antiviral. So it made good sense that we could use it. Anthony Fauci himself wrote a paper back in 2005 about the use of hydroxychloroquine to treat SARS-CoV-1, the SARS infection that happened primarily in Asia back in 2003, 2004. He papered the study saying, use hydroxychloroquine to treat this. Why wouldn't we think if it worked against SARS-CoV-1 that it wouldn't work against SARS-CoV-2? It made good sense. So we weren't just pulling these things out of thin air, but the idea that you couldn't even talk about it was no. I had, for the first time in my clinical career, pharmacists refusing to fill prescriptions refusing to fill a legitimate prescription that I wrote for a patient for either of these drugs, wouldn't do it. You would get, sanctioned by the medical societies. People were threatening your medical license. You absolutely were deplatformed if you talked about it. And this sort of thing, the idea was, no, it's our way or the highway. And their way was stay home until you turn blue and then come to the hospital. We will tie you down, not allow your family in, and give you remdesivir, which is a known nephrotoxic, it kills the kidneys, drug that was responsible for killing, again, millions of people were killed by remdesivir when they could have been saved by simple things like oxygen, steroids, hydroxychloroquine, ivermectin, and vitamin D.
And everything is a risk reward, isn't it? Like everything, when you look at the vaccines, when you look at early treatments, there is a risk reward to any intervention that you take. And I think my issue with it all was that the same advice was being given to everybody, regardless of what your health was, regardless of what your age was, regardless of what your risk was. And certainly here in the UK, I've got two sons who were teenagers at the time, and it was clear that their risk was higher from being vaccinated than it would be if you were older and you had less to lose. But also, if it went wrong, you have to be in the UK disabled by at least 60%. And if you can prove that, you get a payout of £120,000, and that's it. Well, that's not going to take you very far getting you through the rest of your life if you can't work because you've been disabled by a vaccine. So I just found that was a bit weird. And so from a sort of public health perspective, I'm assuming that normally you would take things like that into account when you're giving advice to the general population.
Absolutely. There's nothing in medicine that doesn't boil down fundamentally to a risk-benefit calculation, and that has to be done honestly. So it should have started with the idea that, as I said, children were at such a de minimis risk from COVID as to be fundamentally zero. Healthy children simply did not get significantly ill with it. They didn't pass it on to others. They didn't get hospitalized, and they did not die from it. The only children who succumbed to, quote, COVID were children who were profoundly ill with other things, end-stage cancers, diabetes, those sorts of things. Healthy children were at almost zero risk. So you're right, they should have been stratified. We do that with everything else. We don't treat everybody else the same. There's a reason why everybody doesn't get other vaccines, why everybody doesn't get treated, for certain diseases, because most people are going to do just fine with their innate immune system. And so the idea that they did not risk stratify, as you said, everyone was treated the same. Your 90-year-old grandmother is the same as your healthy 8-year-old child. And that is absolute insanity and defies the actual science. So at the same time as they were saying, follow the science, they were the last people following the science. And they certainly weren't following, there are actually, believe it or not, is a code of ethics for the practice of medicine. Hard to imagine, and I think most people, there actually, is a code and has 4 pillars, the first pillar of which is autonomy, the concept that people have a right to make decisions about what they do when it comes to medical interventions. And a core component of autonomy is informed consent. You cannot make good decisions if you aren't given the actual information. And people should have been told the truth. They weren't, either because the physicians themselves didn't know, or because they knew and they chose not to share it, because there was such a huge financial component to getting your patients vaccinated. In the United States, our hospitals and our doctors made massive amounts of money for having a certain percentage of their population vaccinated. Hospitals got incentivized to have a patient admitted with a diagnosis of COVID. And the brass ring for hospitals was if they could write COVID on your death certificate, they got an additional $42,000 per patient. So we had patients coming in with gunshot wounds to the chest, car accidents, diabetes, cancer. But if they could get COVID on that death certificate, They did. And so many people were classified as having died from COVID when in fact COVID had nothing to do with their demise and likely nothing to do with their hospital admission. It simply was a way to collect more dollars.
I'm really conscious of time because I know you've only got a certain limited amount of time you can give to us today. But I did want to touch on one other thing, which is the politicization of public health. That was one of the things that really I found really extraordinary, yes, especially the way that the left was so authoritarian, because I think I've been brought up thinking the left were more culturally liberal and therefore they would fight for your rights and all that kind of stuff. And it seemed to be a complete switch, and it was the right that was sort of speaking out. Have you ever seen anything like that, the politicization that happened with it?
No, and I think, and that's why I've said that this is part of a bigger plan, Shirley. And again, this is where my conspiracy theorist hat, I suppose, comes on, but I think it's based in fact. The politicization of public health is so powerful because they've set a precedent that all that needs to happen is for someone to declare an emergency. And then that emergency allows them to supersede all of your civil liberties. In the case of COVID, it was this, quote, public health infectious disease emergency that allowed them to control where you worked, whether you traveled, whether you got together in a group, whether you went to church, whether you could go to school, all of those things. Well, who's to say that the next emergency won't be a climate emergency? And that they can now decide you can't drive your car, or you must have an electric car, or you can only drive so far. Or maybe the next emergency is going to be one of gun violence. And therefore, in the United States, we have to turn over our weapons, or we can't have this. Once you've set the precedent that public health somehow controls emergencies, it's in the eyes of the definer who decides what's a, quote, public health emergency, and therefore what totalitarian different mitigation schemes can be descended upon the people. And you are correct, it was absolutely the left that was doing it. This was at a time, at least in the United States, where the right, the conservatives, were going back and saying the Constitution doesn't have a carve out for an epidemic, okay? We don't have a carve out for a virus. Civil liberties are codified in our Constitution, and nobody, public health or otherwise, can change that. We can't amend the Constitution every time we have, the outbreak of an infectious disease or somebody declares, quote, a public health emergency. And so it is that, but I think it was done for political expediency, because once they set that precedent, there's no stopping where they can go with this. They can decide that anything, that racism is a public health emergency, whatever they decide. And I'm just making things up, but I'm proving the point being that there is no end to what they can do or define as an emergency under public health. And if we allow them to do this in the future, they will.
You make such a great point. And I think also as well, it's worth pointing out that that's another reason that the early treatments weren't promoted, because then they wouldn't have got the emergency use authorization for the vaccines either.
Yes, and that's a critically important part for people to understand if they haven't heard that before. In order to have the EUA, the emergency use authorization for these experimental shots, the mRNA shots, they needed to prove two things. Number one, that they had reason to believe that the shots would be effective, but more importantly, that there were no alternatives. That's the piece. And therefore, they had to absolutely dismiss things like hydroxychloroquine or ivermectin, steroids, vitamin D, because if there were any other potential treatments, they wouldn't have gotten that EUA. They would have been forced to go through the rigorous testing that's normally required before you bring a vaccine, quote unquote, to market. So instead, these shots got into and it really was their intention to get them in the arms of everyone. Tragically, there are people out there, and you and I talked about it before we started recording, that are still getting these shots. Fortunately, fewer and fewer are, but there are people out there now that are 6, 7 boosters, quote unquote, into this disaster. Whether or not there will ever be any real repercussions or accountability, I have my doubts, primarily because of the overwhelming impact that it would have. So the best we can do, that I can do, is to continue speaking out, speak the truth, not be afraid to expose the data. It's a constant struggle because the mainstream media, at least in the US, is largely owned by Big Pharma. Big Pharma represents the yeoman's dollars worth of advertising dollars for the mainstream media, and therefore you won't hear them expose most of it. Unfortunately, in Big Pharma, the pharmaceutical companies own our medical schools, our scientific laboratories, and frighteningly, our medical journals. The once storied medical journals like The Lancet, BMJ, New England Journal of Medicine, those are now nothing more than the marketing arm for Big Pharma. There is not a chance in hell that a study, quote unquote, will get published if it doesn't come to the conclusion that the pharmaceutical company paid for it to come to. And therefore, those journals are really completely unreliable. I used to really give myself credit for going to the source, for reading the studies, for looking at the data. Now I don't bother because they are all bought and paid for by the pharmaceutical companies. And I'm hoping that we will finally find some ways around that to bring back integrity to scientific journals and to our mainstream media. And it would begin, at least in the US. I think the US is one of only 2 countries on the planet that allows pharmaceutical advertising on television. It's the US and New Zealand. And there's a reason other countries don't do it. It's a very good practice to not allow it, because once you allow pharmaceutical companies to advertise on TV, the mainstream media cannot give up those advertising dollars, and therefore they won't say anything that the pharmaceutical companies don't want them to say. So if you want to return integrity to the media, it starts with eliminating advertising from pharmaceutical companies.
Definitely. And I have to sort of say, you know, obviously it is still recommended by the health authorities here in the UK for everybody to still go and get their COVID jabs if you are in that vulnerable group. So that is still the recommendation that's going out there. I know you're really tight for time. I just wanted to ask one last thing. Any regrets? Any regrets? If you knew then what you know now, would you still speak out and...
Absolutely. I 100%. I appreciate the question. I sleep well at night, Shirley. I know I've done everything I could do, and I did from the beginning. There are many people coming out of the woodwork now. It's pretty easy to speak the truth now when there's really very little consequence to pay. It hurt a lot in those early days. It was scary. It was lonely. I almost ended up on a no-fly list as a result of it.
Wow.
I had my license, as I said, threatened multiple times. I lost friends, family. I had my name dragged through the mud. People posted unbelievably heinous, untrue things about me in newspaper articles, and I would do it all again. I firmly believe that we have an obligation to speak the truth. I've been fortunate to have a platform and appreciate people like you who continue to give me a platform to speak, and I will not stop doing it. I think it's our only way that we don't fall prey to this again.
I think that's the perfect way to end. I'm incredibly grateful to you for coming and speaking here today, and for speaking out at the time when I know how scary that must have been. And I know that you'd want to encourage other people to speak out now, because we still need people to speak out, don't we?
Absolutely.
So thank you so much for your time today. Thank you so much for everybody listening. I hope you've listened with an open mind and an open heart. And even if you haven't agreed with everything that Kelly's said, I hope you agree that she should have the right to say that. And she is abundantly qualified to have the opinions that she has. So once again, thank you so much, Kelly.
Thank you so much, and blessings to you.
And thanks everyone for listening. I'll catch up with you again soon. In the meantime, do take care. I'll see you soon. Bye-bye.